I have a postpartum story. I went through a really difficult postpartum journey, and the work that I am doing now is deeply personal. I went through a lot, and I just don't want my moms to go through what I went through, right? And so really my postpartum journey starts from the first time I got pregnant. I got pregnant shortly after getting married, so about a year after getting married. Got pregnant and probably carried that child for about 12 weeks. And at 12 weeks, I started having some bleeding and realized that I was probably having a miscarriage. So went into the hospital. They did an ultrasound. The ultrasound shows that there was no heartbeat. And very devastating, probably one of the most devastating things that I've ever had to go through. And after that, they sent me home. They gave me some tramadol, told me that everything was going to be okay. Gave me tramadol and sent me home. So that entire night, I started having a miscarriage. I was having a lot of discomfort. However, I wasn't having a lot of bleeding. The pain was so severe, I actually called one of my doctor friends and talked to one of my doctor friends. And I was like, hey, I'm having a miscarriage. I don't want to have to deal with this. So please help me out. Can you write me for some medication called Cytotec to help speed things along so that I don't have to deal with this through the weekend because I do have to work on Monday. So she wrote me for some medication. And that entire night, I basically was having severe pain. I was having some spotting, not a lot of bleeding, but just severe pain. And I ended up passing out in the shower. I was feeling really dizzy, passed out in the shower, I think maybe once or twice, and felt like I needed to go to the emergency department. And so I called up my job because I was working in the ER at the time. Called my job, I was like, I'm coming in. So went in, they had to put an IV, had to give me morphine, and basically called the obstetricians, the OBGYNs that were on call. And they ended up having to come into the emergency department, and they gave me additional treatment to try to help me through the miscarriage. I was in the hospital in the observation unit. I stayed, and as I was having significant bleeding. So went through that process. It was a Friday, and went home. I knew I had to work on a Monday, so went home. And throughout the weekend, just kind of took it easy. On Monday, I was still having significant pain. Ended up going back to work, went through that whole process that week. It was pretty significant, a lot of discomfort, just a lot happening. I start with my miscarriage story because it's really important in understanding how I ended up getting to the place where I had significant postpartum depression. So I miscarried, and about a year later, my husband and I conceived a child. I got pregnant and gave birth a year later, that same month. And when I got pregnant, the entire pregnancy that I had, the second pregnancy, was really difficult. Right? Because I had miscarried, I went through a period of time where all I thought about with my entire pregnancy was losing my child. So each week I was going through my pregnancy, I was literally terrified of losing a child. Went through it, and I started having bleeding around, I think 8 or 12 weeks. I said, here we go again. Turns out I had something called a subchorionic hemorrhage. It's when the placenta sort of misplaced itself in the uterus. It can cause some bleeding. Moms can make it through a perfectly normal pregnancy with this. I ended up bleeding for about 20 weeks, right? So you can imagine what's going on with my brain as I'm carrying this child for this long, and I'm having bleeding, and I have my prior traumas of losing a kid. Got through that pregnancy, right? Then it was time to give birth. So my birth experience, traumatic. So when I was giving birth, I pushed for about, I would say it wasn't long. I pushed for about 10 minutes. And they had to find the doctor. Couldn't find the doctor. He was delivering in another room. So my daughter had to sit in the vaginal canal for quite some time. And they could not find the doctor. He eventually came, delivered the baby. Baby was dusky when baby came out. He put baby on my chest. He put baby on my chest at that time. Baby was pretty dusky. I wasn't sure what was going on, but I knew something was not right. The obstetrician slowly backed out. He backed out of the room, and he then came in with several individuals. He had about, I don't know, it was maybe 4 or 5 different nurses, different professionals came, and they said, we have to take the baby from you. So they took the baby, and they went and they started resuscitating my baby. At that point, being an emergency room physician, I knew that they were running a code, that something was going on. And so my friend, she called me, and I think she was just checking how everything went, and I told her she needed to get there. It felt like such a short period of time, but she came, she was there, it felt like minutes. She's a physician, a fellow ER doc, and she was able to stand in the gap for me. I wasn't sure what was going on, nobody was talking to me, and she was able to go and say, baby's oxygen is low, they're giving baby oxygen, baby's oxygen is not coming up, baby's probably gonna need more oxygen, is gonna need an ICU, and she kept advocating for me, right? She was talking to the provider, saying, what's going on? I think she's gonna need more. And then they ended up going to take her to the ICU, and my friend was able to go. She was calling me, on the phone. All of this to say, this is how my postpartum journey started, right? I miscarried. I carried a baby. I had a very traumatic pregnancy. And then I had a traumatic birth. And my child stayed in the ICU for about 4 days and was on oxygen. Probably within hours, they're already giving food formula through the nasogastric tube. And she was covered in a machine. When I finally got to see my child, it was probably one of the most difficult things, right? You go through an experience where you want a kid so bad, you lose a kid, right? You go through difficult pregnancy, then you have a difficult childbirth, and now your daughter, you're supposed to be, you feel like you're supposed to be breastfeeding, you're supposed to be doing all these things, and now I'm dealing with my child being in the intensive care unit. So now I'm thinking, is she going to be normal? Is she going to have a normal life? How are things going to turn out for her because she didn't have oxygen for so long? And so that's how my postpartum journey started. And on top of that, my breast milk didn't come out. I was unable to breastfeed for 3 weeks. I pumped. I didn't sleep. I was constantly watching my child. When they discharged us from the hospital, I slept at the foot of the bed, watching my daughter breathe. I watched her breathe. If I wasn't watching her, I was pumping. I had all sorts of pumping contraptions, everything. It was a nightmare. And I always thank my neighbor, she knows this, friend, and she was able to, she would come over and check on me. And she would, kind of put in some plugs. She knew that I was going through a rough time. I mean, I was going through a rough time. I can't even tell you if I was eating, if I was getting outside. I never wanted to leave the house, right? You wouldn't catch me anywhere with my child. I would just sit in the house, and I did a lot of crying. It was really dark times, really dark times. I remember one day my neighbor came and probably saw me with all my contraptions trying to pump. And she suggested that I call a lactation consultant to come to my home. So I called a lactation consultant. They came to my house, and let me tell you how life-changing that moment was for me. The lactation consultant came over. She did a very extensive assessment. She looked at my breast. She asked me history questions. And she told me something. She said, you know what? You have something called glandular hypoplasia, meaning your breast would have never been able to produce enough milk to feed your child. I need you to forgive yourself. I need you to allow yourself the time that you need to bond with your baby. That experience for me was life-changing. Life-changing, right? If she had not come to my house, I would not have been sleeping. I was pumping every hour. It literally was delirious. And so coming to her, her coming to me, she allowed myself to be able to bond with my baby. And so she told me to wear my baby in every possible way I could. When I cook, I wore my baby. I wore my baby on my back, traditionally, how we would do at home. Everywhere I went, I carried her. And in a way, it started the journey of healing that I needed. And then, in hearing my neighbor talk about her journey with therapy and how therapy helped her, I was like, maybe there's something to be said, because I'd never seen a therapist in my life. And so, I went on Psychology Today and I found a therapist. Mind you, I had, failed every assessment at my OBGYN's office and the, pediatrician's office, but nobody had ever suggested that I see someone, right? And I was having a lot of dark thoughts, had thoughts about hurting myself, hurting my child. And so I knew that I needed to do something. And so therapy, seemed like a step forward. And so I saw a therapist, and really changed my life, right? It changed how I viewed myself, the people around me, making sure that I had people in my corner to support me, and just getting through a really difficult time. My therapist helped me find myself. If it wasn't for her, I don't think that I would have made it through that dark time. So I'm sharing my story to help you understand that what I'm doing, the work that I'm doing, is deeply personal. The postpartum work that I'm doing is because I was there, right? I was in that place, that dark place. I was in the place where I didn't have the support, didn't have the resources. And so I want to make sure that people, moms, don't go through what I had to go through. It took me a whole year to feel normal again. It took me a whole year to feel myself. And I literally attribute that because of the people who are around me. I attribute it to the therapist, the lactation, the village that was around me helped literally bring me back to life and help me be myself. And so what I do it because I am passionate about what I do. I do what I do because of my experience. My postpartum journey was not an easy one. And I want to make sure that every woman who goes through pregnancy, postpartum is supported. It's why I have my podcast. It's why I have these events. It's why I continue to talk about this. So I just felt the need to come on here because it's literally been, I had lunch with a friend. I was talking on a podcast today and sharing my story. And I was like, you know what? I really need to talk to you all more. I need to tell you about my story and why I do what I have to do, because it's not out of the blue, right? Everything that I've done in my life has brought me to this moment. One day I'm gonna write a book, not yet, but I just have so much to share. And God gave me all these experiences so that I can be able to help moms and help the people around me. I'm so much better of a person because of what I went through, the losses that I suffered, the experiences that I went through. I'm just able to do what I do and do it passionately. So if you all are looking for support during the postpartum period, or just need to talk to somebody about what you're going through, I really need you to reach out to me. Just send me a DM, call me. I would love to help you. So, all right, that's all. You all take care.